Hello and welcome to the Daily Aus. I'm Billy.
I'm Sam.
A new report into the federal government's response to COVID-19 has found it was not adequately prepared for a pandemic. It also found that public trust in government has been eroded and that more transparency around decisions made during a health emergency is needed. Plus, it has recommended Australia establish a new Centre for Disease Control.
Okay, so Billy, this was an inquiry into how Australia handled the COVID-19 pandemic. Haven't done an episode on COVID in a little while.
No.
Before we get into what the report actually said, what was the intention of government asking for this report to be written in the first place?
Yeah, so this inquiry was announced by the government in September last year, and the aim was to understand how Australia went, with the benefit of hindsight. How did we go in our response to the pandemic? Not just looking at what went well, but also what didn't go well at all during the pandemic. And the intention of that is so that Australia can be better prepared for the future and for the next national health emergency.
I've seen a couple of countries do similar reports, so it's not like we're the first people in the world.
No, not at all. I think it's a really important thing to do, especially when something as big as the pandemic did happen. One thing to note before I get into what the findings were, I just want to point out that this report was entirely focused on the actions taken by the federal government, not by the individual states and territories, who, as we know, especially as the pandemic, went on, they made a lot of the decisions about the pandemic. And that was actually something that the government was criticised for when they did announce this inquiry, was why aren't you including the decisions made by the state and territory governments?
Interesting.
I also just want to mention that it was fully independent. So it wasn't the government looking into the government or the Labor government looking into the coalition government.
It's different governments.
Yeah, it was done completely independently. It was done by experts in public health, government and economic policy.
Okay, so last September they said that they would like this report to be written and these independent writers are going to put it together. That report is now with us and anyone can read it. What does it say?
So it was a 900-page report.
Oh, nice and brief.
Yeah, it was very fun reading for my Tuesday night. It was really extensive. So I'll go through some of the high-level findings. First, I want to mention that although it did get to what did not go right, and that was a large part of the report, it did acknowledge that Australia was quote unquote recognised globally for our response. And they said that although we lost too many lives, we also saved thousands. And they said this needs to be understood as we do reflect. In terms of what could have been done better, I'd say one of the big findings was that trust has been eroded. They used that word a lot, that trust has been eroded. And they said that the population today are broadly more skeptical and more critical of government decision-making because of how the decisions were made in response to the pandemic. And they said that the way to fix this is by increasing transparency over how decisions are made and specifically sharing the evidence that the decisions they are making are based on.
I mean, we talk about this a lot in talking about the early days of TDA because this was kind of one of the first times where young Australians, at least in our generation, had to really understand how government decisions are being made because it mattered about whether you could see your partner or whether you needed a vaccine. And there was, a renewed sense of curiosity as to how the sausage is made in the government. And that's obviously reflected here.
Yeah, and they said that the lack of letting the public know about why the decisions were being made has resulted in the public having less trust in the government at a broad level. I want to read out this quote from the report's conclusion that I think really sums up their findings. So the authors said, quote, "Many of the measures taken during COVID-19 are unlikely to be accepted by the population again. That means there is a job to be done to rebuild trust, and we must plan a response based on the Australia we are today, not the Australia we were before the pandemic." I know this is audio and that hearing someone read out quotes isn't the most compelling, but I find
it soothing, but yes.
I do think that the quotes in this report were very compelling and very strong. There was no mincing their words. So I'll just quickly read out a little bit more. They said, quote, "We cannot predict when the next global health crisis will occur. It may occur at any time, in 12 months, in a decade, or beyond our lifetime. But human history tells us that it will occur, and it will once again test us in ways that are hard to imagine." They also added, "Next time, we cannot say it was unprecedented."
I take back my comment about that being soothing. That's quite disconcerting and really strong. Did the report go into how COVID impacted different groups of people differently?
Yeah, it went into that quite a bit. And I think a lot of what it outlined is what we would have suspected from, anecdotal evidence, but it really confirmed that in really concrete terms. So one example is that it looked at how the pandemic affected women's health, and it found that nearly half of women delayed accessing at least one health service during restrictions. It also said that more generally, women suffered poorer mental health during the pandemic compared to men, and also that women's labour force participation was disproportionately negatively affected.
Wow.
But that's just one group of people. It had a whole list of how it affected different people differently. For example, it also found that people with disability were, quote, "overwhelmingly feeling afraid and forgotten in the pandemic response." It also had a significant impact on the social and emotional development of children and young people. For older Australians, it said that isolation was a big issue. And again, there was a whole lot more there, but it was really interesting.
And it's also really important for the future and for future governments, as they say, next year, next 10 years, next lifetime, to look at how this impacts different groups in society. And there was actually a quote from Mark Butler, who's the current health minister, during the week. He said, "Australia is less prepared for a pandemic now than we were in 2020. Was that from the report?
No, so that wasn't from the report. That was from a press conference that Mark Butler did after the report was handed down. But that stuck out to me as well when he said that. I thought, why are we in a worse position? Haven't we learnt? But I guess that is what this whole report is about. He did explain why he said that. He said, our healthcare system is a lot more burnt out than it was prior to the pandemic. He also said that the Australian government is in a lot more debt than it was prior to the pandemic. And also he said that the people who were in the positions that got us through that pandemic are no longer in those positions. And so that compromises our resilience. But that is why, again, this report is happening.
So the report basically paints this picture of a period relatively unprecedented where a lot of mistakes were made. Australia did relatively okay in the world, but there's ways to do it better. What are those ways, according to the report?
So overall, there were 9 recommendations that the report made, and they also made 26 short and long-term, what they called actions to improve Australia's response. One recommendation was developing a national plan for the next pandemic, and that would include the possible health, economic and social response. It also recommended reviewing the effectiveness of some economic support measures because it said the health crisis quickly became an economic crisis, which we are all very familiar with. And one of the big recommendations was to develop something called a Centre for Disease Control.
And when I saw this, I thought, God, there's an opportunity to not name it exactly the same as the one in the US, because that's the one in America, right?
Yeah, the one in the US is called the Centres, plural, for Disease Control and Prevention.
It's always bigger in America. But what does, I mean, obviously there's an international precedence here, but what would this new centre or centres actually do?
Well, just quickly, you mentioned that there's international precedence for an equivalent organisation like this. What I didn't know that Mark Butler said in his press conference yesterday is that prior to the pandemic, Australia was the only developed country that didn't have this Centre for Disease Control or an equivalent organisation.
Wow.
I found that so interesting.
Oh, well, I guess the senior health figure we were looking to, besides the health minister, Greg Hunt, at the time, was the chief medical officer, who was Paul Kelly. And so this centre would probably kind of take the control away from a government-appointed doctor to more, this is experts on just diseases and how they spread.
Yeah, so this would be a national public health body that is responsible for ensuring Australia is prepared for a future pandemic.
Interesting.
I'm hoping that we'll never have to hear from this body in the future, but what this report was really clear in saying is that there will be a future health emergency and we need to be prepared, and this body is the answer to that. So the government told us on Tuesday that the body will launch in January 2026 So in a year and a couple of months from now.
You're absolutely right. That's a body that I don't think we want to be talking about on this podcast anytime soon. But nonetheless, I think that if it seems to be the way that modern health systems are dealing with upcoming emergencies of this kind of nature, that it seems like something to have in the toolkit rather than not. Billy, thank you for explaining that 900-page report to us on today's podcast.
Thank you.
And thank you for joining us on the Daily Aus today. If you liked what you heard, I'd love if you could jump on our YouTube. That's where we're trying to play with some new stuff. You can click follow on our channel, and that really helps us grow to an entirely new audience so more people can learn what 900-page reports say. That's all we've got for you today. We'll be back again tomorrow.